I am Dr. Sharda Jain. I am the Secretary General of Delhi Gynecologist Forum. I am infertility and IVF expert. I have taught for 2 decades at PGI Chandigarh and Lady Hardinge Medical College. We run the top training course for gynecologists for infertility and IVF in this country, and the same is utilized by the neighboring countries. Very popular course. Now we have started giving instructions in a very simple language to patients who are seeking ART procedures. Before undergoing IVF and ICSI, IVF and ICSI, it is essential for an specialist to ensure that both the patients and the partners are well prepared, and the proper checklist, they check out things. Firstly is the medical evaluation. We review the medical history of both partners, conduct the thorough examination, ensure that underlying medical disorders like diabetes, hypertension, thyroid are excluded, or if they are there, they are well managed. We also exclude tuberculosis, as India is the capital of tuberculosis. As for the fertility testing is concerned, we do assess the ovarian reserve like AMH and FSH, as well as we do by ultrasound antral follicle count for us to know how many eggs the woman has. We also perform histosalpingography or sonosalpingography to evaluate the fallopian tubes are patent or not. In case if they are blocked, then she goes for IVF. At the same time, we also check for male infertility through the semen examination and other relevant tests like DNA fragmentation index. The psychological evaluation is definitely done by the counselor to assess the emotional readiness for IVF and ICSI, and we address any concerns like depression and anxiety if they have before the procedure. In every case, we do advise our couple patient to adopt a healthy lifestyle, including maintaining a balanced diet. No hi-fi advice. It is just to have a simple home food with extra fruits and salads. And we also discuss them for a regular exercise schedule, avoid smoking in case if they're doing it, and also avoid alcohol consumption. We also discuss the importance of healthy body mass index for both partners, and I think this helps in both ways that they cooperate with us. As far as the medication review is concerned, we do assess what medication both partners are having and what can be modified prior to IVF and infertility procedure. Immunization, we ensure that both partners are updated as far as the immunization is concerned, like rubella and varicella, to prevent potential risk during pregnancy. We do infection screening, especially for viral markers. We do like VDRL, hepatitis B, hepatitis C, and HIV, which might affect the fertility and pregnancy. We also do genetic testing in cases of potential hereditary conditions, in cases of azoospermia or severe oligospermia, and also in cases where a patient gives a history that she has a history of mother having a premature ovarian failure, and she herself presents with a low ovarian activity. So those testings are very important prior to IVF. As for the preconception care is concerned, we ensure that the patient is taking supplementation of folic acid to reduce the risk of birth defects. At the same time, we also exclude the deficiency of vitamin D and vitamin B12, and in case if they are deficient, we give a supplementation to them. As far as the lifestyle factors are concerned, we do discuss the impact of anxiety, depression, and stress, and the ways to manage it. We do tell them routinely the relaxation exercise, meditation, and as well as swiso to do as far as the pranayama is concerned. We give financial consultation and detailed breakup of the cost of IVF and ICSI, and do discuss the potential insurance coverage for donor if needed. Consent forms are been given by the ICMR and now by the Ministry of Health, and we do take all the consents required for IVF ICSI procedures. No procedure is done without consent. Sperm preparation is discussed in detail with the husband, and they are told about the regular ejaculation prior to the day the ovum pickup is done. And we also discuss in case if this testicular sperm retrieval method is used, or we do require a standby donor in case the sperm retrieval technique fails to get any sperms. Ovarian stimulation protocol, we explain in a detailed way how many days the stimulation will be used, and what are the medications which are going to be used, and tell them about the OPU procedure as well as about the embryo transfer procedure to them in detail. Support network is encouraged, so they should have a support of family and friends during this particular critical time. Goes without saying that the clinic staff extends them all support. We do tell them follow-up appointments, how regularly they have to come, and also talk about the legal and ethical consideration. We discuss it out in case if there is unused embryos are there, what has to be done. All these details are discussed out in detail with these people. So thus it is important to tailor this checklist to specific needs and the circumstances of each patient, which can vary significantly. Clear communication, counseling, and the support are essential throughout the IVF and ICSI journey to help the patients to make informed decisions and achieve the best possible outcome. Hope you liked the information provided in this video to your satisfaction. In case if there is any queries, you are welcome to ask us in the clinic. And in case if you have not liked and subscribed this particular channel so far, please do it. Thank you so much.